Hello and welcome to Digi8.com.
In this video, we are going to cover the topic on social anxiety. Now let's start with what is social anxiety. Social anxiety disorder is called social phobia. It is an issue with anxiety that results in intense fear in social scenarios. Those with social anxiety have difficulty being part of social settings, meeting others and talking to people. They are anxious about scrutiny or judgment from other people. They might know their anxiety is not rational, but they struggle to get rid of it. The individual is scared of rejection, judgment and humiliation. These fears are caused by real or imagined judgment from other people. Those with this disorder are scared about cynical assessment from others. Moving on to symptoms of social anxiety disorder. People feel their mind going blank. Their heart rate is accelerated. They shiver, perspire or blush. There are stomach problems and nausea. Body stance becomes rigid. They avoid eye contact or talk very softly. They are scared and have trouble being around others. This is particularly true for those they do not know. As a result, they find it difficult to talk to them although they want to. They become self-aware around others. They feel awkward and embarrassed. Next, when does it happen? The disorder can affect people in different ways. However, the following are the most common symptoms. First, while beginning conversations with people. Second, attending an office or class with many people. Third, dining in front of other people. Fourth, while attending parties, again when there's a lot of crowd. Next, going to public washrooms. Next, entering rooms. And finally, while making an eye contact with others. Now let's look at the treatment for social anxiety disorder. First, medication. A medical professional can offer medicines that help with depression and anxiety. This can be done if the situation does not become better after lifestyle changes and therapy. Next, catching up on rest. Sleeping for 8 hours every night is essential. Lack of sleep can make one more anxious. It heightens symptoms of social anxiety. Third, avoiding caffeine. Edibles like chocolate, soda and coffee stimulate and escalate anxiety. Next, group therapy. This teaches people social abilities and methods to engage with others in a social environment. Engaging with others who have the same anxiety provides company. In addition, role-playing may allow one to hone their social abilities. Next, exposure therapy. It involves slowly participating in social scenarios instead of evading them. And finally, cognitive behavioral cure. It allows one to deal with anxiety. It uses breathing and relaxation as tools. It helps remove cynical thoughts and inspires positive ones. Next, what causes social anxiety? Research into the causes of social anxiety and social phobia is wide-ranging, encompassing multiple perspectives from neuroscience to sociology. Scientists have to yet pinpoint the exact causes. Still, we look at some broad causes. First, psychological impact. Studies show the purpose of unconditional or core cynical beliefs and conditioned beliefs closer to the exterior. Core beliefs can be thoughts like I am inept, and conditional beliefs can be thoughts like if I show myself, I'll be rejected. They are believed to be created by adverse events and not on the basis of personality. They are triggered when someone is threatened. Next, cultural impact. Culture can encourage the disorder if it promotes avoidance and shyness. It impacts one's capacity for forming relationships. It deters chances of education or employment and encourages shame. In China, studies show that shy kids are more acceptable than those who are not. They are believed to be more able leaders and competent. This is opposite of how it is in the Western world. Next, caused by substances. Alcohol alleviates social anxiety. However, alcohol abuse can worsen social anxiety. It can cause panic disorders when someone is intoxicated or during the withdrawal phase. Next, social experiences. A bad social encounter can lead to social phobia. This dramatically affects those with increased interpersonal sensitivity. For 50% of the people diagnosed with the problem, a particularly humiliating or terrible incident can bring on the disorder. And finally, genetics. There is twice or thrice as much chance of developing social phobia if a close relative also has the problem. This can be because of genetics. It can also be caused by kids learning social behaviors by looking at parents. Next, how to overcome social anxiety disorder. First, pay attention to others and not oneself. When we are in a social situation that makes us nervous, many of us tend to get caught up in our anxious thoughts and feelings. Your focus is on your bodily sensations, hoping that by paying extra close attention, you can better control them. Changing interpersonal focus to external can significantly help with social anxiety. Next, train in managing breathing. Anxiety causes body transformation and rapid breathing is among the first. Hyperventilation or overbreathing changes the oxygen to carbon dioxide ratio. It causes more significant symptoms. These include muscle tension, increased heart rate, a feeling of suffocation, dizziness, and anxiety. Breathing slowly can help manage anxiety. Next, fight against bad thoughts. It might look like symptoms of social anxiety are incurable. However, there's a lot that can come to aid. Step 1 is fighting the mindset. Next, deal with fears. Anxiety can be fought by instead of avoiding social scenarios if one attends to them. It might look like a task that cannot be achieved, but if approached slowly, it can be dealt with. And finally, try to be more social. Searching for social situations is an excellent way to face fears and deal with anxiety. Finally, let's look at some celebrities with anxiety disorder. First, Oprah Winfrey. Next, Kourtney Kardashian. Next, Taylor Swift, famous singer Adele, Missy Elliott, and Whoopi Goldberg. So that's it, folks. This brings an end to the topic on social anxiety. These are some of the sources and links referred to for the content in the video.
Thank you and see you in the next video.